The task force conditionally recommends using long-term non-invasive ventilation in patients with COPD who develop hypercapnic respiratory failure. We know that advanced COPD patients may develop hypoxemic and hypercapnic respiratory failure, and so far long-term oxygen therapy is one of the main standard treatment options in hypoxemic patients. And now the task force aims to answer whether hypercapnic patients may have some benefits from non-invasive ventilation, because we know that hypercapnic COPD patients have higher mortality. And according to the pooled analysis of the randomized controlled trials, there's a slight decrease in mortality and exacerbation rate in these patients with non-invasive ventilation. Again, we have some positive effects for dyspnea scores, exercise capacity, and health-related quality of life. Because of those reasons, we believe that non-invasive ventilation should be considered in patients with hypercapnic respiratory failure. The task force conditionally recommends using non-invasive ventilation just after an acute episode of hypercapnic respiratory failure. There are not too many data about this issue, but we know that patients with hypercapnic respiratory failure experience readmissions to the hospital. So an intervention with non-invasive ventilation may have a positive effect on these patients' readmission rates. So there are a limited number of studies evaluating the timing of initiation of non-invasive ventilation with inconsistent results. But we believe that patients with high carbon dioxide levels in baseline and who are frequent exacerbators and who have chronic hypercapnia just 2 to 4 weeks after acute episode may benefit non-invasive ventilation in long term. There is no effect of non-invasive ventilation on mortality in these patients, but this intervention may decrease readmission rates. The task force conditionally recommends titrating settings of non-invasive ventilation according to maximal reduction in carbon dioxide levels. We know that hypercapnia is a predictor of worse outcomes, so correcting hypercapnia may be important in the survival of these patients. Recently, some studies show that high-intensity non-invasive ventilation, which targets maximal reduction in carbon dioxide levels, may have beneficial effects both in physiological and clinical outcomes with no major side effects. So because of these results, the task force thinks that titrating non-invasive ventilation settings according to maximal reduction in carbon dioxide levels may be beneficial in these patients. So most of the literature data comes from pressure support mode. But recently, with the advances in technology, newer modes which combine volume-targeted and pressure-targeted ventilation may have some beneficial effects. We call them adaptive or auto-titrating modes. These modes are very important for changing needs of the patient, so they have some beneficial effects in the preliminary studies, but most of these studies are in short term. So for long-term use of non-invasive ventilation, we have to be more confident about these results. For this reason, the task force recommends using pressure support modes during long-term non-invasive ventilation. There are some patient-related and equipment-related factors for the effectiveness of COPD. The task force believes that age and comorbidities does not have much effect for the outcome of patients using non-invasive ventilation. Obesity is an important factor in these factors because patients with obesity, heart failure may have beneficial effects with long-term non-invasive ventilation. When we think about equipment-related factors, the interface is one of the key factors for the effectiveness of COPD. The patient must feel comfortable with the interface they are using. Also, some patients may experience mucosal dryness, so humidification may be another factor for increasing compliance of these patients.